I'm Jessa Almiriel Alfaro, student nurse from Davao Doctors College. And today's video, I'll be performing my return demonstration on how to properly assess the skin, hair, and nails of the patient. But before anything else, we need first to review our client's previous medical records, determine the scope of the assessment needed, prepare the necessary equipment, and lastly, prior to the procedure, we have, of course, to perform hand washing or proper hand hygiene and put PPE if necessary. After this one, we can now proceed to the procedure. Hello, ma'am. I am Jessa Muriel Alfaro, your student for today, and you are?
Jessa.
Alright, how would you like me to call you, ma'am?
You can call me Jack.
Jack. Okay, Miss Jack, what language do you want me what language do you want me to what language do you prefer me to use?
I prefer to use English language.
English language. Okay, Miss Ja, so before we proceed, I need to verify some of your personal information. Your complete name is just Anne Takulin. Your age is 19 years old. You live in Panacan, Davao City, and your status is single. So, Miss Ja, I'm here to perform an assessment in your skin, in your hair, and in your nails. Um, and for me to be able to assess those parts, can I ask for your consent if I can touch those certain parts of your body?
Yes, you can.
Okay, so do you have any questions before me to proceed?
I don't have any questions.
Okay, Miss Ja, and don't worry, Miss Ja, I will rest assured that all the documents that I will wrote here in our assessment is completely confidential between you and me. So, okay, Miss Ja, I have some questions for you here. Do you have any current complaints such as redness, pigmentation, pallor, cyanosis, or any history of the skin problem?
As of now, I still don't know yet. That's why I came here in the hospital for check-up.
Check up in your daily care of your skin, hair, and nails. Do you have any daily care to use?
I just taking a bath daily.
Taking a bath daily. Okay, I've already explained to you, Miss Jet, the procedure, and I'm handling this patient's gown for you to change into your dress so that the skin that's not intended in our assessment will be covered. And now I'm going to perform hand hygiene first. And can you wait, Miss Ja? I will just close the curtains to have you some privacy, okay? Okay, now I already told the patient to change her clothes into the patient's gown, and I already provided the privacy for her. And before that, before we assess into the first assessment, I'm going to put gloves on my hand first. So I'm done. We can now proceed to the first assessment. And for the first assessment, we have an inspection. The inspection of overall skin coloration of the patient. So, Miss Ja, I'll be inspecting your color variation and your skin Can you hand over your arms just like this? Okay. What I'm trying to look here is that I'm looking for any signs of pallor, any signs of jaundice, any signs of cyanosis, because that may indicate the abnormalities in your skin. And for what I observed, that you have a light brown skin. And now we can proceed to the second inspection, which is the lesions. For the skin lesions, can you hand over your skin your hands just like that? Okay. What I'm trying to look here is I'm trying to look for bruises, any signs of scratches or any signs of insect bites, and all that. I will make sure to note that. Okay, ma'am. And for what I observed that in your case that there are no indicators of skin lesions. There are no breakdowns on your skin, and you I didn't find any primary, secondary, and vascular lesions. And now we can proceed to the second assessment, which is the palpation. For the palpation, we need. I'm going to first to palpate the temperature of the patient. So, Miss Ja, I'm going to palpate your textures, and I'm going to put my hands, which is my dorsal hand. Is that okay to you, ma'am?
Yes.
Okay, I observe that you have a warm temperature, and it's normal. Okay, and now I'm going to perform again the the moisture of the skin. And Miss Jet, can you please hand over your arms again, just like that? And also, I'm gonna use again my dorsal part of my hands. Okay, thank you. What For what I observe, you have a moist skin, and that is perfectly normal. So now we can proceed to the texture. And for the texture, I'm gonna use the palmar surface of my three fingers, my middle fingers. Okay, can you please, ma'am, hand over your arms just like that again? And okay, Miss Ja, I observe that there are no present stretch mark on your skin, and there is no textures on it. So now we can proceed to the skin trigger. And for the skin trigger, we want to pinch your clavicle. Okay, Miss Ja, I observe that you have an elastic skin, and it returns to its original shape after I pinch your skin, and it is perfectly normal. So now we can proceed for the edema. We need to palpate for edema. And ma'am, can you please hand over your foot around me? Okay, I'm going to put pressure on your foot or feet. Okay. Okay, Miss Ja, I observed that your skin must rebound easily, and does not remain intended after I put pressure on it, and that is perfectly normal. And next, And next, we can now proceed to your nails, your hair, and for your nails. And to start, I'm going to assess your hair. Miss Je, is it okay if I can touch your hair?
Yes.
Okay. What we're trying to see here, we are trying to see for any signs of skin lesions in your head. Okay, Miss Ja, I noticed that you don't have any skin lesions in your head, and and there is no oiliness and dryness also. So it's perfectly normal. So the next, I want to assess your we need to assess your nails. Can you hand over your arms just like that? We want to look here. We want to note here that the shape, the color, the texture of the skin, and see if there are any present as scrubbing on the nails. So I am expecting, I see here, Miss Jet, that your nails is dirty and broken, and your nails is turning to yellow, and it have a small white spot underneath. So okay, let's proceed now into the capillary refill. Can you, okay, thank you, ma'am. Miss Jet. Okay, for my observation, I can see your um, um, tone that it doesn't returns quickly when I put the pressure and I after I release it. So your the findings of your capillary fill is abnormal. So now for the summarization, I'm gonna summarize all. So Miss Ja, for your assessment, I've noticed that your skin is consistent all over. You have a light brown skin. You have there are no color variation. Skin is intact and there are no redness areas. There are no signs of lesions. Skin is smooth and even. Skin's moisture is warm temperature. The skin is mobile with elastic and returns original shape quickly. Skin rebound, it doesn't remain intended when pressure is released. You don't have any skin lesion in your hair. In your skull, I didn't find oiliness or dryness. And in your nails, I find that your nails is dirty and broken and it turns into um, yellow and your nails is thick. And for the capillary feel, the tone of the nails doesn't return it to the blanched nail beds when the pressure is released. So, ma'am, that's all for our assessment today. And for the date, I'm going to send it to the doctor, and I will just call you or contact you after the updates. Okay. So, ma'am, thank you for cooperation. One